Okay, so what we're going to be covering today is managing stress and preventing burnout. What's not included in this title is how we're going to do that within the coronavirus environment. The agenda of what we're going to be discussing today, 2 parts, really just kind of discussing how stress and burnout can affect healthcare workers. I recognize that not everybody is working right now in the healthcare field, but for the purposes of today, I'm going to refer to everyone as healthcare workers because that's what we are. And it will apply, I think, in whatever work capacity you're working right now. And then the second part, we're going to be talking about how you might be able to manage some of the stress in face of the coronavirus shelter in place. If everybody can make sure to kind of find a space where they can sit quietly and comfortably. If you can just make sure to sit so that you can have your feet on the ground and back straight, hands resting comfortably on your lap. And if you could go ahead and just lower your gaze or close your eyes, what I would like for you to do is just focus on your breath. And focus your attention on your breath at your nostrils. Just breathe in and out naturally. And go ahead and just concentrate on that breath. And if you notice that there are thoughts or feelings, the things that are coming into your mind and disrupting your breath, just bring your awareness back to your breath again. We'll have another minute, just breathing. Okay, and if you can bring your awareness back to the present, open your eyes, take a look around, notice things that are around you, and bring your attention back to the screen. Okay, so hopefully that was a little bit of practice that brings you to the moment in whatever capacity you're working throughout your day. And that just brings our attention back to the topic at hand. So let's talk a little bit about stress and burnout amid the coronavirus pandemic. So talking a little bit about the Stress Continuum Model, just kind of giving some definitions to what stress looks like. You can see in the green section, not having less stress, you're definitely at optimal functioning. You've got some growth and wellness going on. You could see that if there is a little bit of stress affecting you, you may be reacting to that stress. You may have some mild and transient distress or impairment. It's something that is fairly low risk. It's something that is fleeting. For example, if you had a scare, that's a quick panic. Once you calm down, that tends to go away. That stressor just moves along. However, when you start to move into the orange section, when the stress remains, things like, for example, being sheltered in place, it's something that is more persistent. If you're not managing that stress, It can lead to more severe or persistent distress or impairment, and it could potentially leave an emotional or mental scar. Red section is really where you don't want to be. Those things could potentially lead to PTSD, depression, anxiety, substance abuse. So you can see in the stress continuum model, where you may want to be versus not, and when you may need to take action to address the stressors in place, okay? So let's talk a little bit about how stress can affect us in being able to address the needs of our patients. So for the purposes of today, again, I know there's a lot of faculty and staff, and part of your work is addressing the needs of potential patients as well as students. And so some of the stress that may happen for you are things like forced abandonment of patients or inability to meet patient or student needs, costs associated with delays in providing non-emergency services, challenges associated with new learning tools and platforms, i.e. Zoom. This is something that's new for a lot of us. Adjusting to new telehealth rules, being separated from a team you are used to working in close contact with, exhaustion caused by communicating with patients without nonverbal cues, and anxiety around future increase in demand for routine care. As you know, that we are moving towards reopening our businesses and resuming care, and so that can certainly lead to additional anxiety. Okay, some of the common stress reactions during COVID-19: anxiety, your own anxiety or others' anxieties, grief and depression, especially amongst loss of time, income, resources, attitudes and values, connections and affection to others, plans, loss of plans. There's a sense of helplessness, loss of control, and not being able to function as you normally would. Less confidence in being able to function in a system that you were normally able to function in, and now having to work in a new model. Anger, perceiving others' actions, putting self or others in harm's way. I don't know if anybody has ever been incensed when they go out and they see somebody walking around without a mask, or going to the beach and not socially distancing. That certainly can happen to us. And then guilt, not being able to do as much as you had planned to do, not doing enough, or feeling like you're not being empathetic enough, or not addressing people's needs enough, which is what we were normally doing before all of this pandemic happened. Some of the stressors that you might face during quarantine: frustrations and boredom related to isolation, not being able to go out and exercise or socialize with others. Sometimes you might feel like you have inadequate supplies and access to regular needs, like food, water, medical appointments. There's certainly insufficient information or lack of information, confusing information. The longer the duration of the quarantine can certainly have an effect on your mental health. And then there's just general fears of what if you were to become infected, or if you were to infect others. Certainly part of your stressors as you move through this quarantine time. And then some of the concerns that you might have post-quarantine, once shelter in place is lifted, worrying about the financial aspects of your business. How are you going to manage financially yourselves? There's stigma from others as to, why were you having to be quarantined? Are you going to get me sick? And then just, how are we going to resume our normal routine? How's this going to look? Sometimes that can take a while and cause undue stress for us. Now, when you're stressed, oftentimes our strengths, what we thought were actually helpful in our functioning, actually becomes a vulnerability for us. So a lot of times healthcare workers will work under the understanding that it's a good thing to be selfless. But at this point in time, it's not helpful, because if you feel like you're not able to help others, that becomes a guilt issue for you, right? Loyalty, you know that, working to help others and being loyal for others is a good thing. Well, in this pandemic, it again goes to a place where we might feel guilt about not being available to others. Stoicism. This is something that I think a lot of healthcare workers have been asked to do. If something is scary or complicated, if there's a diagnosis that you have to give to a patient, you want to make sure to do it in a way that's not going to make them panic. But not being aware of your own kind of thoughts and feelings and how you're being affected by this can also be a problem for you. Understanding your moral code, knowing what's right or wrong. Again, feelings of guilt and frustration of not being able to offer that to your patients or even coworkers that you're working with. And then same thing, if you're working under the guise that you're doing work of excellence and then not being able to provide those services to your patients or to your students, that's certainly going to come back and bite you in the butt. It's going to make you feel like you're not doing a sufficient enough job. So some of the things that we found to be strengths in the past can actually come back to be vulnerabilities for us and open us up for undue stress. So something to kind of think about and consider. Now, why don't healthcare workers seek help? A lot of times it's our own sense of duty. We've got a strong sense of service orientation. Sometimes we're so overworked that we don't even think about needing to stop and take care of ourselves. Sometimes we have even just difficulty acknowledging or recognizing that we have stressors that need to be addressed, or maybe fear of stigma, of not being able to be strong enough to handle the work, or fear of being removed from your duties because you're not able to manage your workload. So definitely something to kind of be aware of your own kind of self-biases in preventing you from taking action to get help if you needed it. So just kind of quickly talking a little bit about the effects of stress on the body. I'm not going to go over all of this in too much detail because I think we've covered this topic before, and you can read through it in the future if you'd like to. But obviously we know that if you have unmanaged stress over time, it will affect your bodily functions. So what we don't want to do is leave the stress unmanaged, because what eventually will happen is that it will lead to burnout. So prolonged chronic stress can certainly get to a place where all of a sudden now you're no longer just trying to manage the stress. Instead, it leads to burnout, to disengagement, to hopelessness, a detachment, not really having empathy for patients, really just kind of going about your day without any real effectiveness. So ultimately, if you're looking at that stress continuum model, you're really heading into the orange and red zones here with the burnout. So definitely something to keep watch over. So burnout warning signs are things like you're working too long by yourself without checking in with colleagues, you're working around the clock with few breaks, you feel like you're not doing enough. Ultimately, you're using alternative substances to help keep you going, like sweets and caffeine. There are a lot of attitudinal obstacles to self-care, such as, if I were to take time out for myself, it'd be selfish, or other people are doing work around the clock, so I should be doing the same, or the needs of my patients or students are more important than the needs of my own, or I can contribute the most of my time by working. And so again, just really making sure that you're not contributing to your own burnout. So some of the impacts of burnout on healthcare workers: it could lead to increased alcohol or substance use or abuse, broken relationships, poor physical and emotional quality of life, irregular and poor health care, anxiety, panic, depression, suicidal ideation. Not only does burnout affect yourselves, but it can affect patient care. Your compassion is reduced. You have lower patient satisfaction, higher incidence of medical errors, problems with quality of care or patient safety. There could potentially be malpractice litigation. On the grander scale, on healthcare systems, it could lead to absenteeism or presenteeism, meaning that you're there but not really. Could lead to unprofessional behavior, poorer quality of care, productivity, staff turnover, early retirement, or resignation. So it's something, again, to really pay attention to avoid these potential pitfalls. So let's take some time now to talk a little bit about some strategies for managing your stress. There are three areas that I'd like to cover today that I think might be extremely helpful in being able to manage some of the stress that we're undergoing, not only during the coronavirus period of time, but also just, as we return to regular practice. The first is self-assessment, really just being aware of where you are in your stress continuum and whether or not you need to take action to either address your stress or to get help. The second is social support, reaching out to trusted coworkers or family and friends to really offer some additional social support, as well as, a place for resources. And then the third, I do have a compilation of various relaxation strategies. At the beginning of my presentation, I think we did a quick 2-minute relaxation breathing exercise. And so there are additional relaxation strategies that you could use if things start to get really unmanageable and you just really need a moment to relax. So we'll go through these three areas, and if you have any questions, feel free to again, drop some of those questions into the chat box and we'll address that a little bit later. Okay, so the first is self-assessment. There's a few different self-assessment tools. This is a really nice one that really just kind of makes you look at your ability to manage, but in a larger scale. So not even just emotionally, but what's going on with you environmentally or intellectually, physically, occupationally, spiritually, socially, financially. So it's a really well-rounded assessment scale just to kind of take a look at where you're at, where your stressors might be, and how we might be able to specifically address those areas. Another scale is the perceived stress scale. I'm not going to read through all of this because it can be a mouthful, but if you'd like to kind of go through this, when I send out the presentation, you can take it upon yourself to really kind of take a look at, where do you fall in this scale? Are you seeing a lot of your responses happening very often in the last month? And if that's coming up more often for you than not, it's a good indication that you really need to take some time for self-care. Another scale is the well-being index scale. And again, very similarly to the previous scale, just taking a look if any of these, if it's showing that you're indicating more often than not, you're feeling burnt out or worried, again, it's just a strong indication that you need to address some self-care. So some stress indicators, as we mentioned in the well-being scale, things to look at are change in eating habits, change in weight, loss of willpower, losing interest or apathy, not being able to hold a conversation, excessive guilt, taking time off work more often than you normally would, increase in substance use, conflict in relationships, change in sleep cycles, loss of control, not feeling like yourself. Again, there's a lot of things that you could look at that I think would point you in the direction of greater self-awareness as to where you might feel like things are not going right for you. Now, the last two bullet points that I want to point your attention to are the potential for things that, if not managed, could lead to post-traumatic stress or depressive and anxiety symptoms. Obviously, those are things that we don't want you to get to a point of, very much pointing to symptoms of burnout. So definitely something that you want to address before you get to that point. However, if you are already in that point or getting close to that, definitely taking steps to reach out to either colleagues, friends, family, or professional support. Okay. So some things that you can do to practice self-care, very easy things that you can do throughout your day: taking brief breaks for relaxation and stress management, basic bodily care. If you feel like you're rushing around to the point where you haven't showered, making time to do that in your day. And then creating new routines and keeping practice with healthy behaviors. This is something that I think is really important for us as we are sheltering in place. A lot of people have had their routines completely thrown off, and so creating a new, albeit temporary, coronavirus routine is really helpful in being able to maintain your mental health. And then monitor your self-talk, identify and change unhelpful thoughts. If you feel like, you're starting to have more negative thoughts than positive, what are some things that you can do to kind of reframe those negative thoughts and change them to something a little bit more positive? And then definitely limit intake of news and social media. Those are two very real sources of anxiety, especially with messages that might be inconsistent or over dramatized reporting that can lead to unnecessary anxiety. So certainly keep up to date with information, but let's limit that to maybe once a day. And then find ways of expressing kindness and patience and compassion for others, as it really does help to help us feel better. It's almost like that saying, smiling is contagious. Let's do a good deed for somebody else. It really can change your mood for the rest of the day. Some of the self-care obstacles that can come up, again, very attitudinal in nature, like, if others are working hard, I should too. It's okay, I'm fine, I'm not tired. Other people's needs, are more important, so I should address those rather than my own, or, I should do A, B, C, and D more, which is really not going to be helpful in you actually seeking out your own support. And then some of the behavioral things that can be an obstacle for you actually getting the self-care that you need is, working too long by yourself without checking in, keeping stress to yourself, inflexibly concentrating only on what to do next, or relying on substances to relax for extended periods of time. I think a lot of times people will say, oh, I'm just going to have a nice glass of wine at the end of my work day just to relax. Ultimately, it'll help you relax for that time being, but if that's what you're using to cope with the stress, ultimately you're not de-stressing, you're just masking it. So kind of taking note of some of how you behave and how you might be avoiding the need for self-care or addressing your stressors is really going to be important as well. So how might you identify and change unhelpful thoughts? Things like you don't have control over anything. Let's look at some reframing. What are some alternative, thought processes that you can use? So if you say, I have no control over anything, what if we were to change that? I can control some decisions about my future. It may not be everything, but whatever I can control, I'm going to try and do that. And what that is meant to do is to give you hopefulness and purposefulness, being able to move forward with your next goals. Other unhelpful thoughts might be, I should be coping better. Well, an alternative helpful thought might be, well, you know what, I got here today, so I might be coping better than I thought. Or maybe I need to talk with a friend or a mentor or a counselor to help me cope better. That'll help you to feel more hopeful, less helpless, less scared, more capable. So again, negative thoughts can be really harmful in our being able to cope. And, if we can change those behaviors and thoughts into something a little more positive, that can help us change things around. So some things that you can do are things like focus on your locus of control. So obviously with the pandemic, we can't control what happens with that, but we can certainly control what happens in our home. We can, make sure to eat meals at a certain time, make sure that, we're waking up at certain times and getting certain goals completed. And so recognizing that there are things that you can still control within your locus, and allowing that to happen is going to provide you with a sense of capabilities and a lot more positivity in what your day is going to look like. And then the second section is social and peer support. This is something that I think a lot of people might feel a little bit awkward doing, especially if you're more private of a person. But I think it's really important to reach out to others for peer support. I think healthcare workers experience stress that people like family and friends might not understand. And so having a coworker, somebody who's undergoing through, similar stressors, might be, a good person to go for peer support. What might be helpful is having just kind of a buddy, stress buddy, who can check in with you regularly and proactively reach out to you if they see that there's some distress signals, right? You're not looking quite as chipper as you normally are. Can I point that out to you? Things like that. So some pointers on how you might be able to talk to colleagues about stress. Observe, see what your coworkers' behaviors look like, or is there something different? Can you state those observations to them without any judgment? Have just noticed that you're a little bit quieter today. No judgment, just that you're quieter. And then, clarify why you're saying that. I'm just saying that because I've noticed, and I might be a little bit worried that you're not feeling as positive today. Ask them what their understanding is of what's going on, and then how can you help them, provide support. So an example conversation about stress with a coworker is, how are you doing? Oh, I'm fine. Well, I know you say you're fine, but I've been watching you a little bit, and I see that you've been a little quieter and you've been a little bit more irritable, and you haven't been laughing as much. I'm only saying this because I'm your coworker and I care about you. Am I right or am I wrong? It's a really simple introduction to your thoughts to someone, and it opens up the possibility of conversation. So something that the Schwartz Center had developed was the stress first aid. essential skills. So again, recognizing that something is wrong with your coworkers, acting, if you see it, say something, and then trust that the person who is giving you this information has the best interest in mind, and that you have the best intentions to help this person through their stressful period. So finally, let's talk a little bit about some relaxation strategies. I'm going to go quickly through these because I do want to leave some time for discussion. Some of the strategies that we've put together are things like the body scan, progress muscle relaxation, deep breathing, guided imagery, grounding techniques, stretches, and then some mindfulness exercises. So I'm just going to describe these fairly quickly, and then they are a little bit wordy, but that's on purpose because they do provide some instructions. So if you wanted to go back to any of these slides and actually try some of these exercises out, that would be awesome. So the first is a 6-point body scan. It's really just, it's a mindfulness exercise. It kind of brings your awareness to the present by focusing on different parts of your body, and really helps to kind of take you away from, if your mind's spinning on a certain stressor, it helps to kind of take you away from that for a few minutes. Progressive muscle relaxation, very much like the body scan. It helps to kind of bring your attention to different parts of your body. This is a nice one because it actually brings awareness to where you're holding tension in your body and actually gets you to physically let some of that tension go. And so ultimately, after this exercise, you hopefully will actually feel looser and more relaxed. The 7-8 breathing exercises, very much like how we did the breathing awareness exercise earlier in this presentation. This is really just to kind of help you focus on your breathing, and having a progressive holding of your breath really kind of helps to regulate your breathing and ultimately help to relax your body a little bit. Guided imagery, this is a really nice one for if you're feeling really stressed out about a particular situation and you want to kind of change the environment that you're in. If you can't physically leave the space that you're in, you can leave the space in your mind and really kind of bring you to a place that's much more calm and relaxing to help you take yourself out of that stressful moment. Okay. And then the 5, 4, 3, 2, 1 grounding technique. This is again to kind of bring you out of your head and bring you into your present. Using your 5 senses, look, feel, listen, taste, smell, and taste. Really kind of just bringing some awareness to your senses, taking you out of your head for a little bit, bringing you back to the present. Some stretches to your neck. If you're feeling tense, I know that I hold a lot of my tension in my neck and shoulder area, so doing some breathing and stretching really does help with relaxing some of those muscles. And then clearing head and neck tension, again, very similarly to the neck stretch, just really giving you a chance to kind of move some of the tension out of your head and your neck, just to provide some comfort and tension release. And then mindfulness. This is something that is a really helpful exercise in being able to help people with coping from stressful situations. So it's a widely recognized way of managing stress and improving your well-being, and it can be practiced in multiple different ways. There's no one specific way that is touted as the right way to practice mindfulness, but it aims to just bring your attention to selected objects of focus, either breath awareness or things around you that you can become aware of, just to bring you back into the present. So these are, non-judgmental, contentious type of objects that really can kind of bring you away from any harmful thoughts and bring you into the present to give you a chance to relax a little bit. So one of the strategies that has kind of come out of mindfulness practice is the mindfulness-based stress reduction, which was developed at the University of Massachusetts Medical Center. It's an 8-week program, but it really focuses on reducing emotional exhaustion, which, as we discussed earlier, is a dimension of burnout. It reduces stress, psychological distress, depression, anxiety, and occupational stress. So if you're interested in looking into that program more, you can. But there are certain exercises out there that you can practice fairly easily. So this is one such exercise that you might be able to do. And again, I'm not going to go into exercise right now because I do want to open up time for questions and discussion, but know that you can refer back to this if you'd like to practice any of these exercises. So here's a MBSR awareness exercise. This is called an urge surfing exercise. It really kind of helps you to kind of think of ways to help get rid of some of your tensions or harmful thoughts. And then these are some quick 5 mindfulness practices that you could incorporate into your day fairly easily as something that you can do just to kind of break up some of the tension if you have a really busy day, things like that. Okay, another thing that you could incorporate is pause, presence, and perceive. This is a quick, 10-second type of thing that you can do, just really kind of taking a stop, looking at what's around you, noticing things, and then proceeding with your day. It really, again, just kind of brings you back into the moment, disrupts your thoughts just for a quick second. And even just that, 10 seconds is enough to kind of refresh and reinvigorate what you need to complete for the rest of your day. So I'd like to open this up discussion. If anybody feels compelled to provide some insight, feel free to unmute yourself and offer up some discussions on ways that you were able to manage your stress in the past and what kind of strategies worked for you. Does anybody have any thoughts themselves?
I'm not even sure if it falls into any of the techniques that you had mentioned, Jennice, but one thing I do when I stress out, especially now given that I have access to my couch, my bed, any other place that's comforting, I sort of just shut down and slink into the couch and I just don't do anything. I don't even turn on the TV. I just sort of let myself go blank.
Great. Thanks for your input, Twin. Anybody else have any thoughts that you felt like was helpful for you, or maybe you are struggling with how to manage your stress now and you'd like to kind of even just discuss what types of strategies might be helpful for you?
Hi, this is Ernesto. Can you guys hear me?
Yeah, hi Ernesto, we can hear you.
Hi, great. I just want to say thank you everyone for coming and participating. I think you did bring it up. I use a religious form of chanting. I'm a Buddhist, so I do a Buddhist chant. And I find that chanting and doing, I know there's a there's a non-religious term for it. I think it's called, like, I don't know the term, but people use when they say something over and over again, like a reaffirmation.
Mm-hmm.
But that's what I do to keep myself from stress. I'll start chanting. I keep my eyes open, but some people close their eyes. But I do that, and that's just because that's my own religious affiliation. But yeah, I know that there's things that I've seen people do it and meditate without it having a religious context. So I know that that's available too.
Yeah, chanting can seem, it is a very meditative practice. So, absolutely, meditation is a way to relax and kind of take you out of your moment. So absolutely, such a good, helpful thing. So just kind of in review, tips for managing your stress. Just make sure to take time to monitor your stress levels and bodily needs. Fill your cup when you're not on shift by practicing self-care. Utilize and provide social support. Consult with peers and supervisors and check in with family and friends. And then stay mindful of the why you're behind your work and the contributions that you're making. So just quickly, some of the resources that we've used to put this presentation together, but if you'd like to kind of expand on some of your research, you're welcome to take a look at the websites that we've used. And some additional resources that are helpful but have not been included in this presentation is some CBT techniques that you might be able to use to retrain your brain. COA, which is a San Francisco-based mental health and emotional fitness company that have been helping people to work on health and mental health. And then 7 Chairs, it's an online emotional support group. So if something feels like has been really difficult for you as you're kind of navigating your life around the coronavirus shelter in place, you could certainly engage in some of that emotional online support. And Community Health Resource Center also offers a support group once a week on Mondays at I think it's 1 p.m. Twin, remind me if that's incorrect.
You're close. It's 2 p.m.
Okay, yeah. So if anybody's interested in that, you're welcome to contact our main office to also be included in some of our advertising for that. You're welcome to join if you feel like you needed that. Some helpful online smartphone apps that they have released are things like Healthy Minds, Headspace, which is actually for healthcare professionals. So as long as you have a national NPI number, you would qualify for this service. There's something else called Calm Health, and then there's an Insight Timer and UCLA Mindfulness website. Just to kind of give you some resources if you're having trouble with additional coping strategies. So last kind of thought that I'd like to throw out there, in order to care for others, we must first care for ourselves. So absolutely make sure to build in some self-care time for yourself so that you have the ability to care for others. Okay. So I know I didn't get a chance to do questions, so I'll go to the chat, and I have a question here. I'm sorry, a comment and question. So I have found exercise to be a helpful stress reliever during the shelter in place, but I worry about losing that outlet once we return to campus and I lose my weekday time to exercise due to commuting and work hours. Any suggestions? One of the things that I found to be really helpful is if you can be really intentional about building out your routine. If you have, let's say, a lunch period, sometimes it can be helpful to kind of work in a quick walk in eating your lunch and getting back to your work. Other things that I found to be helpful, and I recognize commuting can be quite tough in your time, but if there's any possibility of incorporating exercise into your commute, so if there's a portion of the commute that you might be able to walk, or if you can bike a portion of that, that might be helpful. That's something that I know personally I was able to do, because I know I was finding it difficult to actually find some exercise time. So what I had done was I would park a little bit further from the bus stop that I would normally get off at, and then I would walk the rest of the way to my car. Part of the stress of this coronavirus is also trying to figure out how can we go back to a quote unquote normal way of living, right? And that does incorporate how can we continue to exercise around work schedules, and as we start to open up businesses in kind of a gradual way, some of the resources that were available to us before might not be available to us now. So how can we be creative about incorporating our exercise is going to be really helpful. And I think, just kind of keeping that intention will help us to kind of come up with some creative solutions. So for example, again, what I had mentioned was, when I needed to commute to work and I wasn't getting the exercise in that I needed, I would kind of plot out different commute strategies. So I might take a bus that's a little bit further away before I hopped on the bus, just to kind of get some exercise in. Or if I had my lunch period and I had maybe 15 minutes to just kind of take a quick walk around the block, just to get some fresh air, but also just get some exercise as well. Another kind of strategy that I've heard about, I haven't actually done it myself yet, but you can get some, tension bands and maybe do some weight training in your office. It's something that, doesn't take up a lot of space, and you have some resistance, so you can actually get some exercise in. So some helpful ways or creative ways that I've found to be helpful and kind of getting some of my exercise in. So hopefully that helps with some ideas that people might have that they could use in incorporating that stress reliever into their day. So,
also,
go ahead.
Sorry, Jennice.
Mm-hmm.
I also want to add that it's not really something that you can do right away, but one thing this pandemic has taught us is that remote work is completely possible. Just the way that we see how a lot of businesses and institutions are still functioning in some way, and they're doing it through virtual means, it shows us that before, even if we thought that there was rigidity in our schedules where we're required to be at a certain place at a certain time consistently every week, now perhaps the conversation can be further pushed along about how flexible we all can be with partial of our week being virtual. I know that that's not an immediate solution, but that's definitely something that can be developed into a person's schedule. I know that in particular with students, sometimes their classes can be virtual, and that helps build in the flexibility you might need in order to fit in like exercise in the middle of the day.
Exactly. Thank you so much for that reminder. Yeah, I mean, I think the thing that this pandemic has forced us all to do is to consider a different way of living. And so, if we can adapt to that, we have the ability to adapt to a different way of living, even once, certain things kind of go back to quote unquote normal, right? So what are some creative ways that we might be able to kind of work that into our lives? So last question, how should we address healthcare professionals who have anxiety about coming back to work at the dental school? So good question, Ernesto. I think that's something that we covered. There is going to be anxiety about how that's going to look. I think, definitely making sure to remind everyone to have patience with themselves, as everybody's going to be readjusting to this new normal, right? If there's new procedures in place for, quote unquote, social distancing, or how is that going to work? Are there new procedures going to be in place? If you can make sure to remind everyone to have some time built into their day where they can have breaks, where they may not have had that in the past. If there's a capacity to space out the appointments a little bit further in between, so you're not cramming patients, one after another, that gives the students the ability to kind of take some time to breathe and to relax in between patients, so that they're not feeling like they have to produce as much. And that just kind of gives them a little bit of time to kind of catch up with what's happening around them. So definitely, providing them the space and the outlet to have some time to relax in between clients or patients. And then also, that peer support is really going to be instrumental at this point in time, just maybe having them buddy up with each other so that they can learn to recognize, when a friend or a colleague is not doing so well, and have some resources on hand to pass on to them. And as I mentioned, I'm going to be forwarding this presentation as well, so you can certainly refer back to any resources in the resource section, or even just kind of review some of the strategies and do some of those mindfulness exercises together. So working together is going to be really helpful as we kind of move forward with kind of reopening the business in the school.